Good morning, everyone. On behalf of my co-authors, I will present on HIV and HCV cascade of care among people who inject drugs in the SurvUDI network. I have no conflict of interest. SurvUDI is a HIV and HCV surveillance network among people who inject drugs since 1995. It includes 8 different health regions from the province of Quebec and the city of Ottawa. It is also part of the Canadian track surveys since 2003, and this presentation is on SurvUDI data only. The objectives were to examine trends from 2003 to 2017 among people who inject drugs from the SurvUDI network regarding testing, awareness of seropositivity, consultation with a physician in the past 6 months, and treatment for HIV and HCV. Study participants must be active people who inject drugs. They must have injected in the past 6 months. They must be at least 14 years old, speak French or English, and be able to provide informed consent. Participants are recruited through harm reduction and health programs. A questionnaire is administered by an interviewer. Oral samples are obtained for anti-HIV and anti-HCV antibody testing. Regarding analysis, multiple visits by the same participants are identified using an encrypted ID. The first questionnaire for each participant and each year was retained for this analysis. Wald tests from generalized estimating equations, Poisson regressions, and robust variance were used for trends analysis. Now with the results. For the next few slides, blue lines are for HIV and orange lines for HCV. Here, the proportion of participants who reported lifetime testing increased significantly over time for both HIV and HCV testing. Regarding testing in the past year, significant but rather modest increase were observed for both HIV and HCV testing. It seems stable since a few years, around 60% for HCV and 70% for HIV. The HIV prevalence is 13% and the anti-HCV prevalence is 62.6%. In seropositive participants, the proportion with unknown status decreased significantly over time for both infections, and it was 10% or less in the 5 past years for HIV. This figure shows HIV physician visit in the past 6 months for participants who know they are anti-HIV positive, and HCV physician visit for participants who know they are anti-HCV positive. As you can see, it increased significantly for HIV, but it decreased for HCV. This figure shows current use of HIV medications in participants who know being anti-HIV positive, and lifetime use of HCV medications in participants who know being anti-HCV positive. Current use of HIV medication increased significantly over time, and this increase is quite important, with more than 90% reporting current use in recent years. Lifetime use of HCV treatment also increased significantly. In 2017, slightly more than 30% reported past HCV treatment. I should mention a few limits and strengths for this study. This is a convenient sample with self-report, so possible social desirability or memory biases for some questions. Regarding HCV testing, the information on active infection is not available, then the interpretation for care and medication is more complex than for HIV, and provincial treatment recommendations have changed over time. On the positive side, SurvUDI is ongoing since 1995. It's a large sample including several regions, urban as well as rural sites, and a close collaboration with community organizations. In conclusion, we observed encouraging trends in testing, both lifetime and in the past year, knowledge of serological status, physician consult for HIV, and medication use. However, regular testing is not optimal. 60 to 70% in the past year is not so much, considering that participants are active people who inject drugs. Treatment seems well accessible for HIV but less for HCV, and services must be reinforced and new approaches developed to better link infected people who inject drugs to care, especially for HCV. Finally, many thanks to all participants, to Public Health Agency of Canada and to the Ministère de la Santé et des Services Sociaux du Québec for the funding, and to all collaborators, interviewers, and community organizations. And thank you for your attention.